Good morning, everybody. My name is David Story. I'm the Clerkship Director at Wake Forest for the MS4s. I feel like this is such a benefit to me. I'm usually right before lunch, so I get you before your stomachs start grumbling. So we're going to spend the next little bit talking about visiting rotations, or what they really are, which is a 4-week-long interview. A few objectives with the talk. We're going to talk about necessity, whether 1 or 2 is necessary. We're going to talk about the application process, planning, scheduling, how to manage the rotation itself, and then how to lead the rotation as well. Qualifications, I'm a clerkship director, so in doing so, in being that, I've reviewed hundreds of applicants. In being involved in a residency program, I've also reviewed a bunch of residency applications as well. But my unique qualifications for this talk actually came when I was in your seat as a medical student. I trained in New Orleans at LSU in 2005, was my 4th year. This is a radar shot of Hurricane Katrina, which came through in August of my 4th year. Needless to say, with Charity Hospital going down, my entire school was essentially disbanded for that year, and I completed my requirements for 4th year by doing away rotation after away rotation after away rotation. So I've got a unique qualification in that regard. So do you need to do 1 away rotation? I think most of us would agree that that answer is yes, okay? And for one thing, it gets you what you covet, which is a standardized letter of evaluation, or a SLO. This is what your ERAS application is going to require in order to get your foot indoors at interviews. So this gets you a SLO. Hopefully you'll get one from your home institution, providing you have an EM rotation there. And then we want one from at least one other place from people who don't necessarily know you very well and haven't known you for 3.5 years. The other benefit of a visiting rotation is it allows you to experience something that potentially you don't have at your home institution. Dr. Hiller talked about differences between smaller programs and larger programs, differences between urban versus suburban versus rural communities, differences between academic institutions versus county versus community. These are all potentially very different practice settings. So if you come from a place that is a county program, but your application is going to include community and academic programs, it might be beneficial for you to spend some time at one of those programs and see whether or not that is a learning style or a learning location which you will thrive under and that you will do well. You know, the small versus large residency, the same thing. Maybe you're someone who does very well in kind of smaller groups, so a 6-person residency class is right up your alley. On the other hand, maybe you prefer having 70 to 80 residents going through what you're going through. It's something you have to kind of think about in that self-reflection, and then kind of determine and see if you can expose yourself to that opportunity to see if it is truly for you. Do I need to do 2? This is where this question I think is where you'll get a lot of variability from person to person, depending on who you ask and also depending on who's asking the question. I would say most EM applicants do not need to do 2 away rotations, okay? I think that the number of rotations and spots that are out there probably is not expanding much, but I'll tell you what, the EM application pool is growing pretty decently. So you got to think about supply versus demand of these rotation spots. And if everybody's doing 2, unfortunately that means some people are going to be doing 0. So from a supply-demand standpoint, I think 1 is probably good. Now, there are a couple of avenues why you might consider doing 2, okay? One is personal preference. Again, trying to get another experience that potentially you don't have at your home institution. So, again, county, academic, community, that sort of thing. So that's the easy one, right? The second one is someone who has a perceived weaker application, and they're really trying to boost themselves clinically, okay? And a weaker application is obviously very subjective, right? So talk to your advisors and have them tell you kind of what level of applicant they think that you are based on what you've got on paper. Now, maybe you look at it and you're like, my step score wasn't quite what I wanted it to be. Or your clerkship grades are not what you wanted them to be. Or maybe you had a leave of absence during the school that you have to explain and you feel like that's going to bump you down. Whatever the reason, if that's kind of where you fall and you feel like you have to do something to to raise yourself up clinically, then potentially a second rotation may be beneficial for you. Now, what's the benefit? Well, the easy one is it gets you an interview at a second program, and hopefully a program that you're interested in, okay? You do need to get a SLO from every EM rotation that you go to. I can tell you it's a huge red flag for a program director if the number of SLOs in your application does not equal the number of EM rotations you've done. And that inherently is a potential pitfall, because we're going to talk about how during this 4-week interview, that's 28 straight days where you have to be on your game, sharp, a constant grind. And 4 weeks of that is hard enough. Imagine 8. Imagine if you dovetail that with your home institution, then you're talking about 12 weeks in a row where you don't get a break at all. That's tough. It's hard to do, and it can certainly impact your performance. The other side of it, you have to talk about your own school's requirements. Does the schedule allow you to fit in a second away rotation? That's something that's going to be institution specific. I can tell you, one thing that I've been promoting for the last 2 years now, and this is the second year that I've been doing it, is if someone really wants to do a second away rotation, and they want to do it primarily for the reason of getting another experience or another exposure, do it later in the year. Do it in November. Do it in January. It's still before your match list is due, and it still gets you that experience. It gets you your foot in the door to a program that you're interested in. And guess what? That application process is going to be way less competitive than trying to get in at June or July at some of these programs. So that's something I've kind of been promoting to some of the people that really are pushing towards doing 2. No, it probably won't get you another interview or help you as far as your application process, but as far as a decision-making process, it can be really, really beneficial. The application process. So we spoke about the change in venues. It's still an AAMC website, but it's the Visiting Student Learning Opportunities, the VSLO now, okay? And it used to be VSAS, the Visiting Student Application Service, which we still utilize. I think it's a hybrid this year. Next year, it'll probably all be VSLO. But this is where you can see the programs that are available, see what's out there, what their requirements are. This is also a venue where you submit and upload your own documents, okay? And this is also how you apply for certain blocks, where you want to go, and you can accept or reject offers within this system as well. So as far as the process itself goes, you want to apply early. Most programs probably start looking at these applications in March, I would say. Some programs look a little earlier, some don't open until April, but March is probably a good goal. So you want to have your application pretty much complete by that point. I can tell you as a clerkship director, when I'm allowed by my institution to go into the VSLO and look and see at my applicants, I pull everybody off, I pull all their documents off, I divide everyone up amongst the committee that evaluates, we go through everybody, and we form a rank list. It's like a mini match, okay? And we go right down at trying to line up people that we want to bring in. 2 or 3 weeks after that, I go back into the VSLO and I start looking for people whose applications came in late. I look at them, but it starts getting hard to start incorporating those people into my original rank list because it's been 2 or 3 weeks since I've evaluated those other folks. So getting in early allows you that initial wave, and you certainly get included, and I think you get compared a little bit more favorably, a little bit more evenly with your other applicants. How many programs to apply to? Again, this is a supply and demand issue. I like to say the number should be 6 plus or minus 2, depending on what kind of application you are. And I think that covers most people. If you're someone who got 2 50s on your boards, you got honors on every clerkship under the sun, you've been involved in EMIG, whatever, you can probably get away with 3 or 4 applications. You'll get the rotation you want, and that person definitely only needs 1 away rotation, and you're done. If you're kind of middle ground with some of those numbers, I think 5 or 6 applications is probably enough, And if you're someone who perceives your application as a little bit weaker, then 7 or 8 should still get you a reasonable chance at matching at a program and getting you a rotation. Now that said, if you perceive yourself as a weaker applicant and your advisors say, yeah, 7 or 8 is probably the way to go, you also don't want to load up those 7 or 8 choices with what you think are cream of the crop places. And I know you'll get a lot of different thoughts on what are the better programs, etc. There's certainly certain places that are held in higher esteem, and if your entire list is those places, you might have a little tougher time matching overall. So consider that when you're listing your potential rotations as well. Make sure you qualify for the programs. The biggest thing is malpractice insurance. Make sure your home institution provides enough malpractice insurance for wherever you're rotating. But then also, do they require a letter of recommendation? Do they require a statement of goals for the rotation? Again, just do your homework so you know what you have to upload and get in the system to be eligible at a place that you're applying. When do I rotate? I think ideally, if this were a perfect world, everyone would do their home EM rotation the first or second block of 4th year, and then blocks 3, 4, 5 would be an away rotation. And if you get it all done before block 5, you probably get your slow in before everyone starts looking at your ERAS application, which is ideal. In the real world, that doesn't happen. And I don't think it's a death sentence to have your away rotation later in the year. It's just going to take a little extra work on your part to, when the slow does get uploaded, contact the programs that you applied to and say, hey, I got a new slow in there. I'd love for you to take a look at my application again. So I think that's ideally how you rotate. We talked about the later rotation if you want to do a second one, which I think is reasonable. But just remember that these are limited spots, so you're going to have to be a little bit flexible on when you rotate. How do we choose as clerkship directors? Well, like I said, we use it kind of like a mini match. We look at your CV, we look at your transcript, we look at your step scores. Okay. I personally like to look for something I call commitment to the discipline. If someone's worked as EMS, if someone's been a nurse in the ER, if someone has been a scribe in the emergency department, that lets me know that you've actually been surrounded by the chaos that can be the emergency department, and you have some semblance, an idea of what you're about to get into. That looms large with me. Examples of leadership, involvement in research, yeah, we utilize those, but honestly, we utilize those more as a tie break. A lot of applicants have similar transcripts as far as grades, they have similar step scores, and that's a way for us to kind of delineate amongst people that kind of look very similar on paper. Use your connections. When I was in your situation, I kind of thought this was cheating. If you know someone, I wanted to do it on my own. I wanted to make it to the top on my own. And I realize now that this is what networking is all about. And if you're not going to use your connections to help you improve your lot and where you're at, then why have these connections? Why have this networking? So if you know residents, if you know faculty at a program that you're interested in rotating in them, shoot them an email. Let them know that you're interested. Because as a clerkship director, if I get an email from someone within my department that tells me, hey, take a closer look at this applicant. He reached out to me. I know him. He'd be a really good fit here. She has interests here. I think that would go really well with, the people we have here. Those are the things that I want to hear. And I'll take a second look at that application and say, yeah, we need to bring that person because I heard that I got that email from someone. If you don't have connections at a given rotation or an institution that you're interested in, send a letter to the clerkship director or the program director. Voice your interest. If you're going to do this, make sure that you've, again, done your homework and there's a reason in your email that specifically kind of highlights why you think their program is where you want to be, not just a blanket statement. Okay, so you got scheduled. Now what's the next step? I'd say a week or two before, at least a week or two before you're supposed to show up for day one, send an email or call the clerkship coordinator for that program and say, hey, just making sure that I bring everything that I'm going to need for this rotation. Because I'm not going to be able to just turn around and run back up to my house and grab whatever I miss. So make sure that for documentation-wise, you have everything you need. You can ask whether or not there's any online modules that you need to get done or EHR training, anything at all that will give you a leg up as opposed to starting day one and having all this stuff kind of fall on you. Dress code. Community EDs versus county EDs may have different dress codes. I mean, most of the time, scrubs are going to be fine. Occasionally, there might be a community ED that most of the docs dress in business casual wear. If that's the case, you don't want to be the only person in scrubs. You want to kind of fit in with those folks. So asking what the dress code is, do you have to wear your white coat? Is there going to be a badge supplied, or do I bring my home badge? With regard to scrubs, are my home scrubs okay, or am I going to have to get scrubs there through a ScrubX machine? All information that is worthwhile and meaningful to have. If you have the time and you're there a day early, go find where you're going on orientation day. Go to the hospital and see if you can figure it out. Because guess what? I'm pretty sure the people who design hospitals intentionally make them mazes. Intentionally. And if you can get lost without having to be somewhere at 8 a.m., I'd much rather get lost the day before and then figure out where I'm going. So if you have the time, I would definitely recommend that. Schedule requests, especially as you start inching into interview season. This becomes a little bit of a sketchy topic, right? So ideally, you're not asking for many or any days off on a visiting rotation. You don't want to be the guy that says, yeah, I'm coming to your great institution to have this wonderful experience. Oh, by the way, I need 7 days off out of this 28-day rotation. So minimize it, okay? We understand that life happens. People get married, you got weddings to go to, whatnot. That's fine. Make your requests known early and just limit that number, okay? If you have a bunch of stuff going on in a month where you're going to have to ask for 7 days off, you probably ought to try and get a different month. Okay? Because what you want to do is you don't want to be remembered as the guy who came there and asked for a bunch of days off. During the rotation, you need to be always on. 28 straight days. Every interaction should be treated as if it's part of an interview. Okay? Right down from your formal patient presentations to the chair of the department, all the way down to, oh, I'm having a beer with some residents after a shift. You don't want to do anything that shoots yourself in the foot with regards to this program. If you have a bad interaction with a unit secretary or a nurse or environmental services, it will get back to the clerkship director and the program director. Okay? So you need to always be on your best behavior the entire time. Okay? How else to perform well on a rotation? You know, be enthusiastic, be eager, be involved, be proactive. Go and see patients without being asked. Follow EMS into a room. Make sure you're voicing management plans. Make sure you're asking questions. Be involved. Be active. Basically, offer to do anything at all. You need that ultrasound machine clean? No problem. I got it. Just be willing to be part of the team. Other than that, learn people's names. Introduce yourself. Make sure they know your role. Clarify roles with your attending at the beginning of a shift. We're all different. We all kind of manage students and residents a little bit differently. So by getting that out in the open at the beginning of the shift, you can make sure you're, again, not upsetting the apple cart with regard to those particular people during your shift. So again, it's 28 straight days. It's a grind, but it's a necessary grind because you're trying to impress at that program. Educational activities like sim labs or lectures, anything at all, you want to be active and confident, but not cocky and annoying, okay? You want to make sure you're remembered for the right reasons. Show your knowledge, but don't step on other people's toes. Don't be cutting people off. Again, be respectful. If an interview, a formal interview, is offered during your rotation, that's a benefit to you. That means you don't have to pay money to travel back to this program later on in the year. This is done for you. However, it doesn't matter if you've had the best 3 weeks at this rotation that you've ever had. You feel like you're a fit, you're in, you're comfortable, everyone seems to like you. Treat this interview with formality. Okay? The minute you come in overly confident and cocky and sure of yourself is when your interview process might tailor off and all of a sudden, you've done something again to shoot yourself in the foot. So treat it with formality, even if you feel very comfortable at that institution. Leaving the rotation. At the end of it, stop by the clerkship director's office. Stop by the program director's office. Make sure you thank the clerkship coordinator for the experience, for the opportunity to rotate at that place. Okay? If a SLO has not been offered, bring it up to the clerkship director and make sure that they know you're expecting and you hope to get a SLO. And usually it'll be offered without that, but if it doesn't happen, make sure you ask for it. And then afterwards, if you rotate in June somewhere and the application season and interview season comes along in September, just shoot a reminder email to the PD or the CD and say, hey, just want to know with interview season coming up, still thinking about you guys, still really appreciate the opportunity, and I hope I'll get the opportunity to interview with you. It just kind of refreshes our memory on the folks that have come through. And that's essentially what I got for visiting rotations in a nutshell for you. I'm happy to entertain any questions. Yeah?
You mentioned that sometimes you get an interview offered on site. Is that something where you need to be sure to have your suit and tie?
I would have something. It depends. If you rotate in June, you're probably not going to get an interview in June, right? But if you're rotating in September or especially October, November, that program may even say, well, we'll do it, even if it's not interview dates officially yet, like in October, they may say, well, we're pretty close to that and we'd love to just, prevent you from having to pay to travel to come back. So I think if you're in the fall months, then I would consider making sure you have at least one suit or something that you can interview in.
I think highly site-specific as well. One thing to clarify before you go is whether you will be offered an interview as part of your rotation, because that also varies, and whether it's a formal interview or not. We have 3 interviews that are sit-down lunches.
I believe the MRMatch clerkship tool has something on there that alludes to whether or not programs do that. But absolutely right. An email to the coordinator that says, is it necessary that I bring some fancy clothes? We'll get you that answer.
Yeah. Yeah.
Can you talk about, in regards to away rotations, when it's appropriate to contact the clerkship coordinator or the director? Sometimes I have a question and I kind of want to, I guess, also thank them for the opportunity, but I have a question or something and I don't feel good. I don't want to bother the director, so.
Are you talking about before or after the rotation?
Before the rotation, that kind of thing.
So I would say if you've already been scheduled, the first point of contact would be the clerkship coordinator. And if it's something that he or she doesn't know, then they're going to march that up the tree to the CD without a problem. And I get emails from students all the time, and it doesn't bother me in the slightest. But a lot of stuff could probably be handled by the clerkship coordinator if it's in reference to the dynamics of the rotation itself.
Also, I would say send it to both, because the clerkship coordinator will answer you first, and if they need to, they'll defer to the clerkship director.
The other thing I would say is, just speaking for our institution, the students that we accept for visiting rotations, we see them as prospective residents. I mean, we want you to have a good experience, and we want you to, so I wouldn't feel shy about reaching out at all. I mean, I think we also, you're seeing this as an opportunity to view our program, but we're also seeing it as a chance to show off our program. And so I would encourage you to reach out if you have a question.
Just a real quick note about maybe canceling a rotation. Don't do it the week before, please.
An excellent point. So, we fully understand as schedulers and clerkship directors that, you may get an opportunity at one place that you jump on early, and then a couple weeks down the road, the place that you're really considering, like, this is my dream, what I think is my dream residency, I got that offer. By all means, send an email to to the clerkship director saying, just explaining the situation. And we totally understand that, and we get it. The deal is doing it early. What you have to do is provide us with enough time to fill your spot with another applicant as well. Yeah.
Later in the year, I have a rotation at a real small hospital, but it's an emergency rotation. It's on the Navajo Indian Reservation. And it's not an academic facility, so I wouldn't expect a slow from them. What would you advise about maybe a letter of recommendation from them?
Yeah, that's an excellent question. And a lot of these smaller places that are not academic may not even know what the SLO is. So I don't necessarily, and anybody can correct me if I'm wrong, you don't, if they don't know what a SLO is, don't ask for one. And I think a letter of recommendation from someone within the administration of that department is probably reasonable. And you can always, that should come across in your application as such.
Yeah, go ahead.
I was going to tell her the residence director in Austin, Texas. I was going to add in, don't count that as one of your 2 EM residency-based flows. That's actually a letter.
Yes.
We're looking for at least 2 different places with residencies.
That was going to be my point. You know, when the whole goal of the second rotation or the second away is that letter that's a very objective, you know, account of how you perform. So I just wanted to make sure you had another away, and that wasn't, you weren't counting that as your high stakes away. The only other thing I wanted to make just to emphasize, I really like the slide about with the light switch saying that you're on at all times. And I was talking to, we have 4 medical student ambassadors here, and I was talking to them last night, and there's just this idea with medical students that more is better. And so, you know, all the advising task forces have said if you have an away rotation or a home institution rotation, you just need 1 away. And I just see so many students adding that 3rd away. And just keep in mind that it's hard to be on for 3 straight months. It's hard. If you have 16 shifts per block, you have to bring it that many times. You know, and I've really seen students come to our institution, and I find out it's the student's 3rd away, and they're kind of cocky and overconfident, and, you know, it often doesn't work in the student's favor. And I would say that a bad SLO can be a really damaging thing to an application. So just make sure you're working with your advisors, and you may have covered this before I got in, so I apologize if you did, but you're working with your advisors to make sure that you have a really sound reason for doing a 3rd EM rotation, because it can hurt you as much as it can help you sometimes.
That point about the bad SLO is really important.
Mhm.
I think you noticed also really important, there was a manuscript that was published in, I think it was Academic Emergency Medicine recently, that looked at bad predictors or predictors of a bad outcome in residency, and not writing a thank you note is one of them. This is a really easy thing that you can just check off the list, and your program director, who has probably read that article, will say, oh, not an issue. Any kind of red flag in the SLO will be out, so you really want to make sure you're on your rotations.
Building on the points that you guys raised, I don't have it in me to be on for 8 weeks in a row. I'm gonna screw up. I'm gonna get stressed out because my wife yells at me for being gone. I'm gonna bark at the clerkship coordinator. I'm gonna get caught in going out with the residents, and I'm gonna get extra particularly and say something bad. What about damage control? Am I done if I do that, or are there things that I can do? What should I do if I screw up on a rotation that helps salvage myself?
Well, I think it depends on the level of the screw up, for sure. But you know, if you said something that was, you know, alcohol induced, I think that is probably a little bit more forgivable than on shift being disrespectful for colleagues or other healthcare professionals within the emergency department. You know, I think that's going to be a big one that probably haunts you, is if something gets back to the program director or the clerkship director that says, oh, had a really unprofessional interaction with one of the nurses in the department. That's going to be something that is going to have the potential to totally derail the rotation and matching at that program. You know, and there's certainly degrees of mistakes that you can make, and I don't think that many of them are complete blackballs, but there are definitely things that are harder to overcome, and most of them are going to be interactional things, interactions with other people, because guess what? As an emergency medicine physician, you have to talk to a whole lot of people. You have to talk to patients, you have to talk to nurses, you have to talk to consultants, you have to talk to anybody who's accepting transfers. I mean, this is a very social area of medicine, and if you have trouble interacting with people and that comes across, as one of the issues on a rotation, that's going to be a problem.
Yeah, I couldn't agree more. I think if you step in it, own it.
Mhm.
Learn something from it, apologize, bring it right up front. We recognize that nobody can be on it, nobody's perfect, but we cannot tolerate people who will hide stuff or try and bury it. But if you come and say, he had a really abrasive reaction from a nurse today, and I think I said something wrong, what can I learn from this so that I can get better? That goes a long way towards digging you out, and in fact, might actually make you look a little bit better than your average Joe.
Yeah, agreed. And one more thing about thank you notes, I meant to mention something, so thank you, Dr. Hiller, people talk about like actual written thank you notes versus email thank yous, that sort of thing. I don't think there's really a huge difference between the two, to be honest. Just voicing that thank you, it doesn't matter if it's electronic or actually, pen to paper, if you're going to go that route. I personally get very few thank you notes, and I'm okay with that. It doesn't really affect me personally. But I didn't know about the paper, so perhaps that's maybe you guys should all take a note that thank you notes are a good idea. Yeah, Dr. Wald.
Yeah, one comment in addition to what Tom said. I think, in my experience, you'll less likely have the big screw up, but it's more likely the perception, right? So one thing I would say is, if you're going to bring your phone onto your clinical shift, it's not time to be surfing the internet, checking a bunch of emails, because sometimes it's just the perception. Because what you'll find, at least in regards to the clinical rotation, I agree, it's a great slide with the light switch. I mean, you kind of have to be on, but what you don't want to be is that person who the perception is you're sitting in the corner playing on your phone or surfing the net, because you should be just proactive. Whether if you don't have a patient to see, tag along with one of the house staff. Just stay engaged and just stay. It's a lot of it's attitude and motivation, and a part of it is just the perception that you're there to learn. And if it's a little slow, still find something to keep yourself busy.
On that note, I would add, ask to see patients that have already been seen. There's a lot of patients that we may have seen before you arrived that have interesting findings. Ask if there's anybody with interesting findings. You're keeping yourself busy and you're looking engaged, but it's kind of low risk, right? They already have a dispo, presumably.
Especially if you're at a place where, for whatever reason, they're boarding a lot of ED patients and there's not a lot of new patients coming in. That's a perfect opportunity to make use of your time to at least work on your interview skills, work on your physical exam skills, that sort of thing.